Hello, and welcome to another episode of the Herbal Mana Podcast, where we dive into all things natural, especially dealing with pain, chronic pain, and all the different modalities, all the different things that you can do to help handle your pain. And it could be from athletics, could be from age, could be from all sorts of things, even hormonal and nerves. There are lots of sources. And today we get a real treat. We get a naturopathic doctor who's got a lot of her own experience, plus some pretty cool practice experience going on. Some really cool ways to reach out. This is Dr. Cindy Azevedo. Welcome. Pleasure to have you on. It's going to be great.
Thank you, Todd. Yeah.
Looking at some of your Instagram content this morning, and you've got some pretty cool things going. And I want to kind of start there. You made an announcement about a program. It's about a 4-month-long program, which is pretty interesting to me because many of the things that we're dealing with pain-wise aren't going to get fixed in a quick session. In fact, this is kind of funny. Occasionally look at somebody that has a shoulder injury. It's been going on for months, maybe years. They'll buy our product, they'll rub it on, and then we'll get an email the next morning, I rubbed it on last night, and my 10-year shoulder problem didn't go away. What's up with this product? Kind of funny. So your program, 4 months. Why 4 months? And what's the engagement?
Yes.
What do people get?
Yeah. So typically I start with the initial assessment before I move them into the 4-month program. I like to start with blood work first, and then I move them into the functional care, which is that 4-month program. And the reason for 4 months is because things take time. And I want to take them through a 4-month, which is mainly focused on gut and systemic detoxification. And the reason I do that is we're trying to clean up the crud that's been built up over the years. And that is basically driving their inflammatory responses. That's driving the disruption of their endocrine hormonal system. It's affecting so many other systems. And I focus mostly on gut and systemic detoxification. And I want to remove a lot of the assaults that's been built up over the years. That's creating that oxidative stress, cellular damage, things like that. That's creating that tissue damage that the bodies now have to constantly repair. So it's a little bit of a deeper dive than necessarily superficial, because we also have to work on what's going on internally so that our joints and our aches and pains become less and less over time. So that's where I like to start at least with a 4-month minimum of when anybody works with me, because I want to start cleaning up that superficial crud that's been built up over the years. And we're cleaning out critters, we're balancing out the gut microbiome, we're addressing digestive dysfunction, looking at imbalances in the gut microbiome, any digestive inflammatory markers, we're totally assessing them on a deeper level. And I am looking at environmental toxicants that also a lot of people don't realize what their exposures are. So we're looking at herbicides, pesticides, especially glyphosate, so VOCs, heavy metals, mold mycotoxins, and just so many other markers, even the PFAS, the forever chemicals that gets accumulated. And all of that accumulation does settle somewhere. It's either in fat-soluble tissue or sometimes in bone. There's some heavy metals that do get settled in bone because these are minerals. So it's a slow process. It's not an overnight fix. And we want to work with that tissue turnover to start cleaning up the body.
When I was a kid, if we had a problem, we were taught we would go to the doctor. The doctor would do a quick exam. We'd get a pill or something like that. And shazam, we were fixed. At least that's how we were taught to think. And I've gone down that path. I've gotten those pills, and at times they've done wonderful things, and at times they've done some real damage. When I was a high school basketball player, I'd already damaged my knee, but I really wanted to play my senior year. So I went to the local college. They had a sports physician, a highly acclaimed guy, and he said, what you need is this pill. And he gave me a non-steroidal anti-inflammatory drug, and it was awesome. I did not feel the pain. It was great. Later in the season, I had to go off the pill. And then it wasn't so great. We found that I was just trashing the cartilage under my kneecap. I was bone on bone at age 18 because I got the pill, but we didn't address the function, the real problem in the knee. We just put kind of a Band-Aid on it, if you will, and it didn't work out so well.
Yeah. That euphoria is very short-lived, and it's not long-lasting, and it's not a long-term solution because there is a little bit of damage that's being done to the joint tissue and that wear. So on top of the wear and tear, and then you've got that additional damage to the joint tissue to where you're just adding a little bit more wear and tear and being prone to injury, because then you're not you're also losing the sense. There's a protective mechanism with pain that's telling you, okay, I've got to back off. This is not good. And you're kind of diluting that protective mechanism, which is a direct connection to the brain too, because
That's
obviously
what I wanted. I thought, and I wasn't told otherwise.
Mhm.
Wrong. I was naive. I was an 18-year-old kid.
Mhm.
I had surgery the spring of my senior year, my second knee surgery, and I already had a hole about the size of a quarter in the cartilage under my kneecap. So I was just grinding into the bone, but I couldn't feel it. Like you said, we missed that protective signal that comes with having proper feedback, proper nerve function. And in this case, we just completely muted the nerve function. Not too awesome. Now, you could have gone that route with medicine, the allopathic route. You obviously did not go that route. How did you know which way to go?
Yeah.
Actually, before that, actually start with, for some of our folks, allopathic, because sometimes we throw that term around, versus natural or functional or whatever the opposite of allopathic is.
Mm-hmm.
And the path.
Mm-hmm. So with allopathic, it's a little bit more of focusing on suppressing the symptoms, and actually a lot more. So you're not addressing the underlying causes. You're kind of going in and just addressing and suppressing those symptoms. And it's more, you're medicating, which in the end is just suppressing things, and it's not really addressing it. And you remove those medications, or you remove those things that have been suppressing those symptoms for a long time, things do come back with a vengeance. So eventually they do have to get addressed. Now, with the other option, and this is the direction of more naturopathic, either even a little bit of that integrative route as well, or functional medicine. And this is where we are looking at more of those underlying causes. And it doesn't necessarily mean that there's one fix or there's one quick thing to address. Often it's the accumulation of multiple factors over time. And so there's a little bit more of a process to it. It's different than surgery. Obviously, if there's been significant tear, if there's a broken bone, depending on the fracture, surgery might be needed. Obviously, we want to avoid that as much as we can. We want to avoid the route of drugs and surgery and just any unnecessary invasive procedures.
I could have done well with that advice 30, 40 years ago. I've had 24 surgeries, 20 orthopedic surgeries.
Oh, wow.
A few broken bones, knee replacements, multiple screws in one of my feet. Some of that was going to happen probably because I just wasn't put together properly, some of the joints, but some was just not great decision-making. Well, actually, it's not even that. It was lack of information. We were going to a very traditional doctor, very traditional routes, orthopedic surgeons and such, not the functional side. Did not go that direction. Now, Europe, did you have health challenges that pushed you one way or the other, or kind of took the blinders off for you?
Yeah. So my formal training is obviously, I have a doctorate in naturopathic medicine. I also have a master's in acupuncture. And that is also,
Awesome.
yeah. So that kind of contributes to, most people go to acupuncture for some type of pain condition for the most part. So from a young age, I've had scoliosis in my thoracic spine. And obviously there's musculoskeletal imbalances that happen from that. And I'm not one to take medications. And so I was always looking for some other options. I would do chiropractic, I would do PT. And then I also tried acupuncture. And this is when I was young. And I was going there for the back pain that I was getting from the scoliosis. So that is kind of what took me down that route as far as adding in that for a pain modality or just for pain relief. And acupuncture is also really good for menstrual cramps. And there's a lot of topical products that you can also use for menstrual cramps too.
I've had acupuncture, which is awesome. I've also had dry needling, which is very situational and awesome. So what's the difference? How do people know which one to pick?
Yes. So I haven't had this conversation in a while with a lot of folks, especially where my practice has been online for a few years now. But when I had the physical brick and mortar practice and I did a lot of acupuncture in that physical space, that question would come up a lot. And what I would tell folks is, so there's a difference in education. And I'm not bashing anybody by saying this, but as an acupuncturist, you do go, I went to school for 3 straight years. and you get the full philosophical education and just the full understanding of the energetics of it, what each point means, like why and how the meridians interact with one another. As far as dry needling, I've never, I haven't taken dry needling other than when I was in acupuncture school. But as far as taking an additional certification in dry needling, I'm not one to speak. That's not my area of expertise. Like I'm not a subject matter expert in that. But what I can say is oftentimes the depth of education is not there. It's more orthopedic. But oftentimes it's maybe a weekend education or, however many weekends of education. And then you come out and you're dry needling. And a lot of other professions are doing it. There are some acupuncturists that do focus on dry needling, and they'll use that as their marketing. But there are other professions that also do dry needling. Like I know PTs.
Chiropractic, PT.
Yeah, yep. PTs, chiropractic, a lot of those physical modalities that anyone who does a lot of the physical modalities will do that. There's massage therapists. They're not using needles, but they're doing cupping. And then in my practice, I did a lot of cupping. That's one of my favorites, actually. I helped a lot of people with cupping. It's just, and I did fire cupping. And so there's even massage therapists that are doing fire cupping, which is, I think it's a great modality.
Being that I had was fire cupping, I thought it was a little odd at first, but it was great.
Yeah.
In the hands of the right person. I actually bought a suction kit, really nice set for doing cupping for myself. And it arrived. I was excited. I opened it up, and then I realized, crap, I don't know what to do with this. I can mimic what has been done, but I really don't know. So it sits on my shelf. I know where it is. Nice, pretty red case, but without some instruction, I'm going to dive in. We kind of like doing, even dry needling. I kind of get the idea. I know it works with releasing knots and some acute issues. Actually, the last time I had it done was with a PT, and he was very respectful of acupuncture. He said, I can do this. It's for this kind of knot, this kind of impingement, very limited. It is not full body. It is not treating the energetic fields. We're not trying to get some sort of balance. We're just taking care of that nasty knot in mine was in my forearm. And he said, that's it. We're focusing right there, that little thing, not holistic in any way, just treating something that's a symptom, a limited problem. And I thought that was great. I really respectfulness about what he could do and what an acupuncturist can do.
Yeah, that's a great way to put it. And just to add to that is an acupuncturist kind of thinks more of kind of that bigger lens of, looking at things from a constitutional perspective. And there's many components to add into the constitutional perspective of the person, whereas as someone like the PT who's doing the dry needling, it's very specific, more to a particular muscle and where that tension has accumulated and where those trigger points are. Not to say that people don't get relief or benefit from it. People do. What you're doing is, and the achievement or the goals are just different from one practitioner to another. And everybody practices so differently too.
What about the labs you mentioned? Why do you get labs? Why do you just size me up? I spend 5 minutes with you like my MD would like to do. Can't you just do that?
So I like to start with the blood work because I want to know what their baseline is. I've come across where it's like, oh, I did blood work. I saw my doctor, he did some blood work, and they bring in the report. I'm like, okay, I need more information than this. So this is where I just do a comprehensive blood panel, and I'm looking at typical things. Like I want to know what your inflammatory markers are. I want to know what your thyroid, just metabolism, like just basic things like a full thyroid panel. I want to rule out autoimmunity, especially there. Cardiovascular.
Check on all the labs I just went through this morning with my doc, my naturopath.
Great.
Ordered some up a few weeks ago, all those check. And it's a long setup. I think they took half my blood just to get everything because she wanted to see everything again. We do that every 4 or 5 months for me because I've got celiac, some other stuff going on. And she really wants to be dialed in because I keep changing the answers. The blood work is not static. It sure be nice if I could get blood work today that maybe I'd be good for 3, 4, or 5 years. But I think for most of us, it doesn't work quite like that because things are always in flux.
Absolutely. And you want to use the labs as a gauge and so basically whatever the goals are, whatever you're working on, and people are working on different things in different phases, or they're working on multiple things all at once, but you do want to track. And that's where labs are great. These are just different biomarkers that we're tracking over time. We want to assess, all right, how is the treatment plan going? And as far as making adjustments, and this is how you tweak your plan or your care. And you don't base everything off of the labs. It's the labs is a component to it. You do obviously take into account the person that is in front of you that you're helping, their symptoms, how they're feeling, and just so many other things that play into the picture. But the labs is absolutely an important component. And I like to look at inflammatory markers. I like to look at what's going on with their cardiovascular system, their lipid markers, but in more detail. I like to rule out any food allergies. Just FYI, I was like, all right, let's just kind of get an idea. Let's just rule out that, maybe this symptom is not relating to a particular food allergy that you're probably not aware of. Because an allergy is different than a sensitivity. And there's so many other, as far as the blood work, there's so many other markers. But I could give you a link if you're interested in that as far as the breakdown of everything. And then from there, I like to do functional lab testing.
I think that would be kind of cool to put in the show notes.
Yeah.
So people can start to see labs are more than just 6 or 8 things that you might get tested with your primary care physician. It's a bigger world. There's so much more information that is useful in the right hands.
Mm-hmm. Yes. And circulation is absolutely important. And so the microvascular system. And so just looking at cardiovascular labs, just looking at total cholesterol and lipid markers, I don't think it's enough. They're not looking at homocysteine. They're not looking at the oxidized LDL, the LP(a). These are little things, like little grains of sand that affect the vascular system. I just want to know where things are as far as a status before I move them into the next stage of care, which is what I call the functional medical or the functional labs aspect of care. And that's where I love to work on the gut. Most people that come to me, there's something going on in their GI system. Anytime there's an immune system involvement, we have to check the gut. You mentioned celiac. So obviously you've got an autoimmune condition. That's what celiac, and it's gone to a level to where you are reacting to gluten. So it's not just wheat, but all the other things that contain gluten. And I do like to check the wheat zoomer. So that's part of my gut workup. I'll do the gut zoomer plus the wheat zoomer. The gut zoomer is looking at digestive function because I want to know, all right, like, is your digestive capabilities, is it strong enough or does it need support? Are we lacking enzymes? Or is there enough bile acids and things like that? Are you breaking down? Are you digesting your fats? Are there any proteins that are showing up in the stool? Is there any fat that's showing up in the stool? Is there any blood that's showing up in the stool? And sometimes anytime there's an overgrowth somewhere. One thing I learned in acupuncture school, I'll just say, basically, excess comes out of deficiency. So if there's an overgrowth of some bug, then obviously likely chances are that there's a lack of, basically the beneficial probiotic species, because we only have so much real estate or space within our gut for these bugs to populate and take up space. So obviously we want it to be much more populated with the beneficial species that we have a synergistic symbiotic relationship with, because they do produce food for our colon cells. And we don't want the overgrowth of pathogenic stuff that can do damage to our gut lining, affect our immune system, trigger autoimmune responses, and things like that.
Common are digestive issues with your patients, your new patients coming in? Is it 1 in 100, 1 in 10? How common is it?
It's very common. I've tested practically everybody's gut that's been working with me. And granted, let me preface by saying that most people that when they come to me, there's something going on. So most folks have something going on in their GI tract. There's not enough stomach acid, and I can kind of tell by certain species within the gut zoomer. And if there's an overgrowth, if there's an overgrowth within the small intestine, it's like, all right, if there's a lot of stress in the system, you kind of start putting the pieces together, because you need the parasympathetic nervous system to engage properly. And that is what's going to stimulate the stomach acid release, the pancreatic enzyme release, the bile acids to go. So all of that is coming in so that you can digest your food properly, break it down into smaller parts, and then you can get basically vitamins and minerals and get that absorbed within your small intestine. So malabsorption comes into the picture pretty often when I check their micronutrient status. And I don't often check that in the beginning. I might check some micronutrients, but I can pretty much bet if there's some GI system dysfunction, if they're getting a lot of GI discomfort, chances are there's likely some micronutrient deficiencies and malabsorption and things like that.
So we found my celiac because I had stress off the charts, no reason for it, none whatsoever. So I went and had a talk with my doc. She did some testing and found that I couldn't absorb anything because the celiac I had so damaged my intestines, I couldn't absorb a lot of the nutrients that I needed. I couldn't make dopamine, for instance, because I couldn't absorb what I needed to absorb. And then she had to put me on a long, slow, patient process to heal up so I could actually absorb the stuff I was eating. That was life-changing because before we got ahead of it, the stress alone wasn't quite incapacitating, but it was close. It was rough, and for no reason. But my body thought it was in stress, as though I had some really heavy emotional burden that I was carrying. I mean, that's where it showed up. It showed up with the GI problem because I couldn't absorb what I needed to build the right stuff, all the feel-good hormones I needed.
Yeah. And probably to repair any damage that was done to the musculoskeletal system and all of that.
That was part two. I worked out, but I couldn't recover very quickly. Normally, I should be able to work out, recover, whatever body part I worked on. I should recover in a couple of days. I wasn't recovering. I was sometimes taking 4, 5, 6 days for a single body part to feel like I could recover, go back to the gym. It just wasn't happening like it should happen. And the 4-month program.
Yeah. So going back to that, so the 4-month program. So obviously I check their gut and I like to check for their toxic exposures. And just as I said, was cleaning up just kind of cleaning up the crud, fine tuning things, getting their digestive tract better functioning, clean up some of that systemic accumulation of some toxins. And it's very personalized. They get one-on-one care with me. It's not a group program. Eventually, I do want to add in a group component to this as far as modifying the program. But right now, it's all one-on-one care. They get a wellness curriculum that's very educational because I want them to live a lifestyle that's compatible with health and healing, but for the long term. Because my goal is I don't want them to rely on me for the rest of their life. I want to get them well. But I don't want to, kind of like the acupuncture practice. I don't want you coming in every single week for the rest of your life. If that's the case, I'm not a good practitioner and I'm not doing something right. So I want to get
hung up on healing and wellness instead of a sickness plan, which, the allopathic side kind of maintains us in that position.
Exactly. Yes. Get you to a place of maintenance care. And we can always touch upon some higher level modalities or higher level testing but we're building on that. Let's get the foundation solid. And that's where lifestyle plays a huge aspect because what you do day in and day out, these are your daily exposures. So not only we're cleaning up the crud that's been built over the years, there involves behavior change. I also want you to add in and incorporate some behavior change that's not overnight. It comes with time, but just so you're not going back to those behaviors or those habits or patterns that got you into where you are now. I want you to start changing those habits, behaviors, and patterns and bring things to your awareness so that you're a healthier version of yourself. So your care with me, I absolutely would love to support your care, but it's the frequency is less and your body is stronger. It's at a place where life is going to throw stuff at us. I mean, I don't have a crystal ball to predict what's going to happen, but life is going to life and things are going to come at us. But I want to get your body to a place to where, so when that dial, that dial gets thrown off center, your recovery is faster. You can just bounce back faster.
If I want to work with you, I don't live near you. How do I connect with you? I think I'm 2,000 miles away.
Yeah, so my practice is online. So distance is not a factor. As long as we have good internet connection, we're able to touch base. If there's poor internet connection, then I always touch base with folks by phone. The labs are shipped directly to you. The gut zoomer is a stool test, so that's a simple collection. You ship it back to the lab. We go over the results. The environmental toxicant panel, so that's a total toxic burden plus the PFAS. That's a urine test. So same thing, it's a simple urine collection. And then you ship that back to the lab and we go over everything together. And then also I work with a health coach. So you're getting the personalized care with me, but you're also getting the care of a health coach to where they're guiding you through the whole lifestyle aspect. And it's nice to have another person alongside with me, and we're both your cheerleaders to support your care. So it's a high touch point program because
actually really caught my attention, because if I go to a regular MD, because of their protocols, no matter how awesome they are, they only have so much time they can spend with me. In fact, I've got several buddies that are MDs, not as happy as they used to be. And I tease them a little bit because I tell them they've got the 4 P's of practice: poke, prod, prescribe, and then push them out the door because they've got to get to the next patient. And your approach sounds quite a bit different from that. It sounds like you're spending real time, real follow-up, a program, not just a quick poke and out the door I go.
Much more contact time for sure. So I review the labs. I add my lab interpretation notes onto the labs, and I'm the one that's reviewing the labs with you and answering your questions. So I'm not delegating that out to a physician's assistant or some other practice, anybody else in my practice. And so we're working one-on-one together. And then with a health coach, same thing. The health coach is working one-on-one with you. We have different roles, but our roles absolutely do work together in conjunction to support your care.
Nice. All right. You mentioned in the labs that you look at inflammatory markers. What are you looking for? And why does it matter?
So the state of inflammation actually matters. There's generalized markers. So in the blood work, there's HS-CRP, high sensitivity CRP, C-reactive protein. It's very generalized. I like to look at ferritin, which is also a generalized marker. It does get raised with any type of like generalized acute inflammation, but I like to look at that. Same thing. The HS-CRP is a generalized marker of inflammation. Homocysteine has to do with cardiovascular system, and also it has to do with methylation, which is one of the detox pathways. There's different detox pathways. Methylation is one of them. There's sulfation, and there's glucuronidation. But the methylation is important because it involves the B12, B6, and it also has to do with some proteins. So at least it gives me an idea of what's going on with some B vitamins, how you're breaking down those proteins, because it has to do with the methionine to homocysteine. So it has to do with that protein cycle there. And then cardiovascular, there's the apolipoproteins I like to look at. There's myeloperoxidase, that's MPO. And I will look at that if it's a white blood cell marker, but it gives me an idea if that's engaged, then all right, we've got an inflammatory response that's setting off the immune system. And then that also can also affect the vasculature. If we've got a cut, like say if the vessel, there's a cut on the vessel, whether it be a large vessel or a small vessel, the way that it repairs itself is actually through cholesterol. Cholesterol is being called to the area to repair, but it's patching up the area because you don't want that open cut to stay open, and then you've got, you don't want to bleed out. So I like to look at some of these other markers just to get an idea of what's going on with the vasculature, because there's a lot of things that can impact the health of our vasculature. Toxins, absolutely one. Toxic damage from a variety of different exposures, whether that be respiratory, we're breathing in mycotoxins, or we're breathing in, VOCs or anything like that. And, heavy metals absolutely do affect the lead, high blood pressure. There's kind of like that connection there. Mercury affecting especially with mercury amalgams affecting the brain. If we're looking in the mouth, anytime anybody's had a root canal, I always refer out to a biological dentist. If they still have mercury amalgams or silver fillings in their mouth, I do refer to a biological dentist when they can to get that removed, but safely removed. But a root canal is often a source of hidden trapped infections. So when we're dealing with, if I'm looking at the labs and the MPO is elevated, I'm like, all right, there's some infectious component on here, because infections can also affect the vasculature.
Hunt is on to go find that little bugger.
Yeah. So I just I'm not afraid to refer out. So like if I see anything that's outside of my area of expertise, I will definitely refer out, because if we've hit a wall, if we've hit a point where it's like, all right, we've done all this and obviously there's effort that's required on the other end, because we can't guarantee any results, because the other half of the program is also the effort from the person that I'm working with. But if I see like they're working hard and we've hit a point, it's like, all right, let's look at some of these hidden infections. And if there's a history of a root canal, I will absolutely refer, like, get that addressed, get it assessed with a 3D cone beam scan. I just want to make sure that that is something that I'm not missing.
That overall approach.
It is more holistic.
Yeah, got to find the source. And it's not likely you could just throw one pill at a problem and be done, at least not for any of us that have a lot of mileage on. It's going to be a little bit more of a hunt to find the real sources, the real problems, and get them addressed. Now, in your case, you actually walk the walk as far as being active, and you've dealt with injuries. I see on your social media, you're actually dressing up in your workout clothes and heading for the gym. Have you dealt with injuries lately?
I have. So yeah, so in November of 2023, I was doing a CrossFit workout. So I've been active ever since my teen years. I like being physically active. I've enjoyed working out. And so over the years, I've done some intense workouts and, in different, I like to change it up so I don't get bored. So a little over a year ago, I was working out and I felt something on my low back and unexpected. It really slowed me down. And I didn't realize till later what it was. I had some imaging done because this back pain just wasn't going away. It was more sacral, but it was lumbosacral, but especially sacral. And I was just self-treating. It's kind of the name of the game. When you're a practitioner, it's not uncommon to have practitioners treat themselves. It's kind of expected. And so I was treating myself with a variety of different things, and even just whatever I could put, like putting patches back there, all kinds of stuff. I grabbed my my laser, I would laser the area, everything. And I was like, all right, this is...
Make sure you're reaching around to your back, blindly sticking needles.
Yeah, whatever I could reach. I did chiro, I did PT, like months of chiro, months of, like all of it. And this is unusual because usually my recovery is faster. Like I can recover pretty good. I was like, yeah, this is something serious. It's not typical pain. And come to find out after imaging, it was L5-S1 disc herniation with an S1 nerve impingement, but it was bilateral nerve impingement, moderate on the left side, mild on the right. Okay, that would make sense. It's like, obviously something is irritating a nerve, right? And that's why I've been having this pain for a while. It's like, because this is not my typical, workout, aches and pains. I was doing Epsom salt baths, all kinds of stuff. And then I came across your products. And I've been using different topical products, and I came across, I actually have your Alpha Warrior, and then I have the Knockout pain relief, because there's frankincense and there's obviously, and then DMSO. That's what I liked, because I was looking for something with DMSO because I wanted to apply that topically with some essential oils, and you have frankincense in both of your products, which I love frankincense. Yeah. And it's hard to find products with DMSO, and DMSO is awesome because it just drives things deeper into the tissues. So this has actually been part of my recovery and relief, along with behind me is the infrared heat lamp, and then
it's infrared because you actually get more penetration.
Yeah.
Better than just a radiant heat source, which is also nice because I really like warmth. Love warmth. Should not live in Idaho because I really like warmth. But for warmth, the radiant heat isn't quite the same as the infrared heat. I use near and far infrared and some other heat sources that really do make a difference. Now, you mentioned, as we were talking before the show, that if you do the heat with the cream, that you get a little bit of a residue.
I do, yes. So I was applying the Alpha Warrior cream directly on my back, right on my sacrum, like right around that SI joint area. And then I would put the heat, and I would put the heat directly on it after application and just kind of let that seep in. And one thing I found is I would get a little bit of the flakiness or that residue.
That is hyaluronic acid, which is awesome, but the hyaluronic acid takes just a little longer to absorb. When we put the products together, we'll use low molecular, medium molecular, and a little bit of high molecular weight hyaluronic acid because they affect different parts of the skin. And DMSO, the low molecular weight hyaluronic acid will actually go right down into the joint, into the muscle, into the connective tissue. But the higher weight takes a little bit longer. That's helping with the skin, helping with hydrating, skin irritation, generally helps with inflammation. And if it dries too quickly, a little bit of flakiness. They also use the knockout pain roller. That is brand new. We're doing something with, it's kind of crazy on our part, with bare knuckles fighting. They're kind of like the UFC. I was just at an event in Philadelphia over the weekend. It is a different crowd, a crazy bunch. And they wanted something that could help with their fighters when they're training, and of course, all of their following. So we created something a little special just for them, which is that roll-on, that we have a different variation of the cream, because those folks really need to be able to train. And after their craziness, they need to be able to recover better. And DMSO really helps, really helps. The other problem with DMSO, and the reason it's not more common, is it's a little bit hard to source pharmaceutical grade, and it's a little tricky to manufacture with. You can't just throw everything in a pot and stir it up. There's quite a bit you have to monitor with the concentrations, with temperature, the order of processing things, the pH levels. So it takes quite a bit to put it together, but it's awesome. Absolutely.
Yeah. So when I use the knockout pain relief, when I use this definitely absorbed pretty quickly. I just apply it on the skin, and it didn't need much heat. It went right into the skin. And then I learned when I apply the Alpha Warrior without the heat, I didn't get the residue at all. It definitely absorbed. It's a little thicker, so it took a little longer, but this was quick absorption. And I just apply it before I go to bed. I'll apply that, and then I have the heat lamp behind me. I shift the lamp so that it's facing my back as I'm laying down, and it works.
All right. I'm glad to hear it's helping, because that lower back is hard. Boy, it's hard when you've got a little injury. I had problems with L4, L5. I thought were related to a bad knee. I had a knee replacement, well, actually 2 knee replacements 10 years ago. And I already had pain from my hip going down my right leg. I got the knee replacement, did not resolve the pain, at least not all of it. That's when we took x-rays and found that I had herniated discs, a couple of those, and some other scar tissue built up. And I could not just rehab around it. I finally had to go in and just kind of trim things a little bit, open up a little bit of room for the nerves and everything else to function. Those low back injuries affect everything. Sitting, standing, coughing, sleeping, everything. So they are buggers.
It is.
Really.
Yeah. This has been a slow recovery from this. When I learned of the nerve impingement, I was like, okay, now this makes sense. Because it totally drained my energy. It affected my sleep. Just sitting, it was worse sitting. And so I'd have to just do as much as I could standing.
Yeah, that constant pain, that's just plain wear you out. That's why we got into Herbal Mana. My son, who's really the genius behind the formulations, saw what I would go through, because I've had all the problems for so many years. And he could see that it's just plain wearing me out. And that's true with a lot of our customers. A lot of the folks that use our products, they're just worn out, because the chronic pain just kind of grinds you down. Limits what you can do, limits how well you can sleep, limits a lot of things. And it just takes a overall toll on the health. That's part of the reason I was really intrigued when you talked about your 4-month program and digging into inflammatory markers, underlying problems, gut issues, diet. This is where a lot of people just kind of blow it. They're trying to get their joint pain under control. They want to get the inflammation under control while they're reaching for the Oreos, while they're drinking their soda pop. And it's quite an internal battle we create. I mean, we can use our awesome product, and we can take some awesome supplements and then reach for that can of Coke. And then the battle's on to see who wins. It's quite a battle, quite common. And it's regrettable, because a lot of folks stay in that state of low chronic inflammation because of what they're choosing to consume. So the 4-month thing is awesome. How do folks find that 4-month program? Is it going to be on the website, or is there another source?
Yeah. So I encourage people they can start with a discovery call. I want to make sure that we're fit to work together. And that's right on the website. And you can book it there directly through the website. There should be a button, I think it says book now if you scroll down. And that will take you directly to the scheduler. And that's usually how I start. If they want to bypass the discovery call, they can. I don't charge for the discovery call. The purpose is just to make sure that we are going to work well together. That's the main thing. But if they know that we're going to be a good fit to work together, I work with adults, so adults can make their decisions, right? And then they can just start with the initial assessment, and there is the button for that as well, directly on, I think it's a start here or start now or something to that effect on the website. And they can just purchase the initial assessment bundle, which is basically the comprehensive blood work. So the kits are going to get sent directly to them. The lab ships the kits to their address. And it includes my lab interpretation and my notes. They get all of that. They get digital copies of everything. I don't keep anything from you. And then it also includes the initial consultation that's bundled in. So we review the labs together, plus go over your health history together and start piecing everything together. And then we can decide as far as what the next step's going to be. And if all looks good, let's go to the next step, which would be the functional care program, which is the 4-month program.
I think it's awesome. And I think it's really going to move the needle for folks if they're willing to commit, get some good advice, get some good insights, and actually commit for 4 months. It would be a game changer.
Mm-hmm.
So wonderful. And the fact that you can do it remote is great.
It is.
It's going to be such a limiting factor.
Yeah. You know what? It is. Just for the area of access, even if you're on a different time zone, we can work around that. You're not stressing yourself out, trying to deal with traffic, rushing to a visit. A lot can actually be done virtually. And I'm a big proponent of getting people to take the responsibility for themselves and truly invest in what really matters, which is, themselves. Basically, it's their health, themselves, and their family. And in whatever work that we do together, most folks have a family, right? Or there's a significant other in the picture. And often there's a ripple effect, So even if I'm working with one person, that one person is interacting with other folks in their circle, in other relationships that are in their lives. And that also gets impacted because when they're feeling better, they're in a better mood. So that also improves their other relationships in their life as well. Yeah.
Well, I love that. What's the website? I know we'll put it in the show notes, but it's good to have it.
Oh, yeah, no problem. So it's hollygrovehealth.com is the website.
In Massachusetts?
I'm located in cold Massachusetts. I'm
well, that's
like
why
you. I don't like the cold.
And yet you're in Massachusetts.
I know. It's crazy.
I think you've got the heat lamp over there and the other heat lamp over your left shoulder. That's great. Oh, that's awesome. Well, to be respectful of your time, I suppose we ought to wrap up. I could go on listening to you for another hour, but this is awesome. I love what you're doing. Love the social media presence. I love that you're sharing real value. Your posts aren't just fillers. You're actually telling folks some good information, giving some good advice, sharing some good tips, which is great. And again, that 4-month program is wonderful. I think if people want to make a real change, that to grab on, take advantage, and start moving the needle, start addressing some of those health issues.
Absolutely. And, and it's worth investing in your health, particularly as soon as you can, not necessarily waiting until a serious problem or a serious disease condition awaits or just starts appearing. Like the sooner that you start addressing things, the better you're going to set yourself off into a trajectory of health. And it's better to pay now than to pay later. The payoff, I think, is absolutely worth it.
It must be something. I was talking to a friend recently. She found this book. It's a book that helps you fight cancer with your diet. Once you get cancer, and she says, as soon as I get cancer, this is my book. And I asked her, why not start now? If that diet really does help address cancer issues, why not start now before the storm comes? Make the changes sooner than later.
Yeah, it's easier to make the changes when things are a little easier, less burden on the body, versus waiting until there's more of there's more complexity that's added into the picture. It's the effort, and it can be very draining and exhausting. That's the other thing is oftentimes if somebody waits until there's a serious disease condition that's really been wearing them down, these things happen over the course of years. And most things don't typically happen or come to surface overnight. There's been a lot of wear and tear and dysfunction over the course of years, particularly if it gets to a disease state. And often, just kind of backtracking a little bit with allopathic medicine, even though you may do a bunch of labs, blood work, whatever, they're looking for a disease state, an actual diagnosable disease state. And oftentimes when you wait to that disease state, it's not a good state to be. And when you work with someone who is a little bit more holistic minded and you start working with them sooner, you're hitting things before it becomes a disease state.
Yeah, so much more impactful.
It is.
If I really get out of it, I know I'm going to have some problems, but dang, if I can avoid the big ones, why not avoid the big ones? get ahead of the problem, make the changes, get a little discipline, and make life a little bit more enjoyable.
Mm-hmm.
All right, Dr. Cindy. I appreciate your time. This was awesome. If you guys like this content, subscribe, follow the show, reach out to Cindy. If you need to make a change, actually, unless you're in superb health, no problems, no inflammation, no aging, no wrinkles, then you don't need to bother. But if you've got anything other than that, you do well to reach out. You really need to get into a program. It's got to be process. You've got to have some rules, and it's just so much easier with a coach. Tiger Woods has a coach. All the great football players have coaches. I think for health, it's just smart to work with a coach, or in this case, more than one coach. Dr. Cindy plus others. Anyway, it's awesome. Appreciate your time.
Thank you, Todd. This was fun. And even if somebody is they're not necessarily to a place of where things are really bad, but they just want to stay on top of things and they're feeling pretty healthy, just checking some oxidative stress markers, some longevity markers. These are more advanced things that can also be checked, just being proactive, which doesn't...
Where they become a problem.
Yeah. And being proactive is not a bad place to be and not a bad mindset to have.
Not especially since so many of our problems are driven by inflammation, for instance, that can be discovered through labs, some diligence, little coaching before they become an issue.
Mm-hmm. Yeah.
Sooner the better.
Absolutely. And when you're in that proactive mindset and less reactive mindset, you can make better decisions going forward.
All right. Thanks again. I appreciate your time.